Welcome to Black Health Matters. I'm your host, Darryl Armistead. This is a Howard University Hospital transplant support group session led by Dr. Clive Callender, who is a noted transplant surgeon and professor of surgery at Howard University College of Medicine. Let's join today's session in progress.
Uh, this is an article that surprised me in a way in that we all know about social determinants of health, but just asking about it and going into detail actually provides long-term benefits for people who have kidney disease. And so this article points out that when uh, people are followed up on the absence of the social determinants of health and things are done to improve them, the follow-up care for people with kidney failure significantly improves. And this is important information that is common sense, but uh, health literacy and understanding what the social determinants of health are, and following up to try to minimize or eliminate some of those social determinants of health can make a big difference there. And that's what this article is all about. Any other comments? It's kind of common sense, but we don't have data to support the common sense. Okay, go to the next article then. It's interesting. This is an article that talks about the one food that more people should eat, and it appears that broccoli is that food, and it acts in so many ways to decrease cancer and to improve health. As we know, vegetables and fruits, whole grains, are and plant-based protein are the way to improve your health. And broccoli is one of those foods that works in many ways to promote good health and also particularly to decrease the likelihood of cancer, especially breast cancer. I don't know how many of you like broccoli, but because there are many vegetables that may be similar, but this article points out that broccoli is one of the better ones. Any comments about broccoli and its effect?
I love broccoli.
What's that, Dolores?
I love broccoli.
Sophie, good morning,
Okay.
everybody. I love broccoli also, especially if it's roasted.
Roasted.
I like broccoli as well.
Mm.
Put cheese sauce on it though.
Mhm.
I like it without the cheese.
I also like it plain without the cheese.
hmm It is something easy to fix, and I need to do that. You think you live alone, you can't eat healthy. I have to retrain my mind. I'm going out today, and I'm going to get some broccoli.
And I also found out that broccoli is very good for your pets, especially dogs.
Really?
And I feed my little Lily broccoli at least 3, 4 days a week.
Hmm.
And she is moving better.
Okay, this is looks at other ways to lower breast cancer rate. It talks about turmeric, which we've talked about before, and avoiding the alcohol, processed foods, and burnt foods, which is something that more information is identifying it as a increased risk for cancer. Okay, any other comments? If not, we'll move on to the next article. This is an interesting article that talks about processed foods uh, being the problem, and that without depending on GLP-1 drugs, well, we may tend to forget about the toxicity of ultra processed foods. Uh, and this is so important as we look at the type of plant-based proteins that we consume, and as we try to eliminate ultra-processed foods, eating more fruits and vegetables and nuts and other things that are not processed. And this is something that the more and more papers and the more data we see, the more important the plant-based diet is, the healthiest of the diets. Even though we tend to like uh, the processed foods, they are not good for us. Cheeses as well. Of course, of all of the nutrients that is helpful, the two that are probably among the most dangerous are sugar and salt. Of course, nothing uh, is quite as good in addition to the healthy lifestyle as the exercise and the meditation that goes right along with it. Dolores, you had a comment?
No.
Oh, okay. All right. It it's amazing. All of the articles say the same thing. And so we've got enough uh, articles that keep telling us the same thing again and again. So if we are not exercising, not uh, increasing the plant-based diet and meditating, uh, then it's actually on us. So any comments? Of course, we also mentioned about uh, resistance training and weightlifting as well, because the aerobic exercises alone without the resistance exercises uh, are not optimized. The two together will work well to improve your health. Any comments? If not,
I have a request. Someone who has their microphone on who's not muted, there's a radio or TV in the background that's feeding over. So please mute if you're not sharing. Thanks.
if this uh, emphasis on cutting your plate in half and uh, making most of it filled with uh, fruit and vegetables is an important aspect of diet. This is an interesting article that talks about high fruit intake in women. And, improves the lung function, particularly when you have air pollution, which we have so much here in the United States, particularly after we have all of these fires. And so uh, women with high fruit intake have better lung function than those people who don't have high fruit intakes. So they say take at least 4 portions of fruit every day, and that will help your lungs function even better than ever. Yeah. Seems like air pollution is at a new high. We have so much uh, fires and air pollution that this is something that we have to deal with in many countries, including China and Japan and other countries across the world.
Is there any fruit better than other fruits to help your lungs in high polluted areas?
We've had a couple of articles that pointed out that since the recent fires, that air pollution is at an all-time high, and that this, of course, is a problem for people who have chronic lung conditions, who have bronchitis and bronchial asthma and other such conditions. And in some countries, people wear masks because of the air pollution. So there's a lot of data recently that has been pointing out the association of air pollution with increased respiratory problems. John Buchanan?
Yes, Dr. Callender, Joyce was asking, is there a specific fruit or groups of fruit that serve better for this?
This article, they just say more fruits and vegetables. They don't outline which fruits.
Okey-dokey.
Thank you.
And they emphasize fruits and vegetables. So, okay, I guess we can go to the next article. More question. This is an article that we've talked a lot recently about microplastics and forever chemicals that are polluting our bodies. And apparently, chewing gum is one of the ways that, and so many people do it in all aspects of life. It's amazing. It's almost uncommon to see people who are not smoking, who are not chewing gum. And this article suggests that this is one of the ways that microplastics gets into your body. Of course, the real issue is not so much that avoiding microplastics, because it seems almost impossible to avoid. But uh, when you have them, we don't have a mechanism for doing away with them. And so trying to find ways to decrease the amount of plastics microplastics that our bodies consume is thought to be something that we need to do. Plastic containers, of course, and we tend not to even think of chewing gum, but it's hard to see a sports event where somebody's not chewing gum. And so it reminds us that that's a source of microplastics as well. So between microplastics and forever chemicals, we're finding out that these toxins are causing more diabetes and other diseases.
Mhm.
I wish there were more ways of eliminating these forever chemicals and microplastics. And one of the weaknesses of all of our presentations is that we aren't finding ways of dealing with these toxins once they are in our bodies. And most of the data suggests that they are in our bodies and in most organ systems. And they talk about substituting uh, things for plastic, which bottled water drinking practices and other things. There's so many ways in which the microplastics and the forever chemicals uh, are ever present in virtually everything we do. Any other comments or thoughts about other ways of dealing with this huge problem? Darryl?
Yeah, that's right. We can't really shed the microplastics in the body. The microplastics are inflammatory, and antioxidants can help counter and deal with the inflammation. And so the key foods that are most antioxidant are the vibrant red, purple, blue hues in fruits and vegetables that come from the plant compound anthocyanin. And these foods are particularly higher in anthocyanins. And that includes berries like blueberries, blackberries, raspberries, cranberries, and acai berries, vegetables and grains such as red cabbage, purple sweet potatoes, black beans, black rice, purple corn, and other fruits such as grapefruits, cherries, plums, and pomegranates.
Thank you for sharing. Thank you. Okay. Any other questions or comments? If not, we'll go to the next article. This is an interesting article that talks about the fact that the blood pressure target is not as useful for older patients, although the data that they use in this article don't really prove the point. But they are suggesting that sometimes these trying to get a target of 120 over 80 may result in hypotension and other things that may cause fainting and other complications. But actually, they don't show much data that supports that thought. They just conclude that while trying to get to 120 over 80 is desirable for older patients, it may cause postural hypotension and cause other problems. But they don't really show data in this article that proves their point, although it's suggestive stuff, but not really data that identifies the extent to which hypotension is a side effect of trying to keep the blood pressure at 120 over 80 or lower. Although they point out that they think that this is something that could be a risk for syncope and falls, uh, particularly in the older population. But they don't share any data that proves their point. And that's probably the weakest point of this article, is that it's data poor. It's interesting that above the age of 80, they're suggesting may not be the case, but they don't have data to support it. John Buchanan.
Yes, what is syncope?
That's when you faint.
Hmm.
Yeah, when you faint. Yeah, when the pressure goes so low that you fall out. Yeah, that's syncope.
Hmm.
And those who have postural hypotension can faint. And this then is a side effect. It would have been nicer if he identified to what extent that you had syncope and falls as a consequence of the uh, antihypertensive medication causing that. But he doesn't show data, which is the weakness of this article.
Hmm.
John, you still hand still up, or you?
Oh, I'm sorry.
Oh, okay.
There you go.
Any other comments or questions about this article suggesting that this figure is too low for people over 80? And he also points out that he tries to link the hypotension with increased dementia as well. Again, he doesn't uh, show us data that would support his point. But this is the new target for many people is the 120 over 80. Although there's still people who feel that 130 over 80 is the better target. But most of the studies with data have identified 120 over 80 as the goal. So that should be the next paper that gives us the data that supports his argument. It certainly is true that it's much easier to relate all of this to people who are under 65, but he is particularly addressing the group of people who are over the age of 80. Janice?
This might be minor, but my blood pressure is pretty much consistent. It's usually 130, but it stays 60 and not 80. Is that lacking anything, or is that within a range?
That's
It's
right.
low.
That's okay.
Yeah.
The lower diastolic is not a problem. Uh, uh, and uh, there are those who think that the goal of 120 over 80 is the ideal, and most of the data uh, suggests that you have the best result when you have a systolic of 120 or lower.
Okay. Thank you.
Any other comments or questions about this? Is a very important aspect of targeting pressures, and the data is mixed. There's a lot of data that agrees that 130 over 80 are the targets, and you got a lot of other data, particularly for people under 65, which the data shows that 120 over 80 is the ideal target. But the truth of the matter is that it seems like the target changes every year.
Mm-hmm.
Some years is 120 over 80, some years is 130 over 80. So,
Mm-hmm.
okay, if there are no other comments, let's go to the next article.
Oh, excuse
Although,
me, Dr. Callender, I do have a comment. I see that it's associating low blood pressure with dementia.
say again?
They're associating low blood pressure with dementia. Is that
Yeah, correct.
okay?
They are,
Did not know that.
but they don't show any data.
Yes, yes.
That's correct. They say that, but they don't show data that supports that argument.
Thank you.
But that is the argument that they have, is that the orthostatic hypotension that may result increases the incidence of dementia. But they don't really uh, show us any data that supports the argument. They just give it to us and don't And so an argument without data is just an argument.
Yeah. And I thank you for sharing these types of articles, even though they don't have all of the supporting information, because it gives us guidelines to when we read things, what to look for. So thank you for just still sharing this with us.
Yeah. Okay, this is an article that says maintaining cardiovascular health early is the key to having cardiovascular disease prevention later in life. So the healthier we are when we're young, the healthier we are when we're older. And so the sooner we develop a healthy lifestyle and healthy diet and exercise and meditation, the less likely we are to have cardiovascular disease as we age. Once again, an ounce of prevention is worth a pound of cure. And all of the studies and the data they have supports that. Any comments or questions about this fact? I think the data certainly supports this argument. And this is something that is problematic, is that in spite of all of the efforts we make, the number of people who die from cardiovascular disease still is the number one cause of death in the United States. Which suggests that people are not taking their blood pressure medicines and not keeping their blood pressure under control. And most of the screens that we do support this fact, because most of the people who are hypertensive are people who know they have hypertension, but they're not taking their medicines.
Mm.
Darryl?
Yeah, I just did a search on whether professional athletes have greater longevity than the general population. And, that's going what this article says, that early healthy lifestyles lead to less cardiovascular events later on. And it says, yes, most professional athletes live longer than the general population, with endurance athletes seeing the greatest benefit. But that's not universal. The exception is football players. They have shorter life expectancy due to factors like head trauma. So I think the encouragement would be to encourage our grandkids not to play football. Encourage them to be athletic, but keep them away from football and boxing.
That
Good
makes sense.
advice. Sound like good advice to me. But it may not be as easy to keep your grandkids away from those sports.
I think it was last year or recently, more recent than that, they did some sort of search or analysis because a lot of kids were getting injured due to head trauma in playing football. And some of the parents were actually against them playing, even though that's the number one sport of young boys. Everyone likes to play football. But yeah, it does cause a lot of head trauma. And sometimes it's not diagnosed early. It's much later in life that you have the results of it.
Thanks for sharing. Any other comments?
Yeah, I had a comment. And I've seen this in several articles. They say black and white. And for some reason, I don't like that because there are so many different colors in the spectrum. You know what I'm saying? And even though brown people may have specific issues, and those that are very light have specific health issues, I I don't like it when they just have the opposite ends and don't really consider uh, all of the different ethnic groups that are out there. And the other thing is the money aspect is what's attracting so many of these kids. They see these athletes making millions of dollars, regardless of their educational level. Um, that's a big attraction to getting into those sports that are uh, dangerous and unhealthy. But the money and the attraction of having multi-million dollar homes and rich cars and Mercedes and Rolls Royces, those kind of attractions cause the kids to want to play those rough sports. Thanks.
Thank you for sharing that perspective. Um, but when you have somebody like LeBron James, who's now a billionaire, and Magic Johnson is a billionaire, uh, people remember from whence they came. And uh, LeBron finished high school, and that was it. Uh, so it's interesting that the points you bring are good ones, but uh, when people see what's become of those people, here you have a guy like LeBron who just finished high school, and he's got he's a billionaire, and he's got a high school that has brought a lot of young kids and given them an education. So it's interesting to look at it from both perspectives, because no matter what we say, that example that they see is there for them to try to imitate, suggesting that you don't need to to graduate from high school or college to become a billionaire. You just need to be a good athlete,
Well,
and that's
as far as health goes, though, basketball and baseball are a lot safer than football.
yeah, absolutely, they are. But you see the UFC and the boxing and the people getting killed in boxing all the time, and so it's uh, it's perplexing. Uh, what role models do they choose? And that's so. Thank you for sharing your perspective. Any other points, perspectives you want to share? Okay, well, let's go to the next article then. This is an interesting article on testosterone therapy and its impact upon prostate cancer and benign prostatic hypertrophy, which is common for men over 65. And the concern is that, of course, when you have a low testosterone level, that the treatment is testosterone therapy. And this therapy itself may affect your prostatic enlargement and your prostatic cancer. Uh, Although it's thought to decrease the risk for prostate cancer, it is also thought to increase the likelihood of BPH, which they call benign prostatic hyperplasia. By the way, next week we're going to have Dr. Coleman talk to us about the male and female concerns of urological issues as they relate to men and women. Uh, and in that talk, she will talk about some of these aspects of the impact of testosterone as well. And you see these commercials that talk about a low testosterone level uh, being treated by testosterone. Darryl?
Yeah, I'm guessing that Dr. Coleman is going to say some of the primary ways to boost testosterone is exercise, particularly with weightlifting, getting enough sleep, 7 to 9 hours of quality sleep, meaning that you're not getting up to pee, and eating testosterone boosting foods that includes foods that are rich in magnesium, vitamin D. That'd be your dark leafy green vegetables, and eating uh, healthy nuts. So do all of that, and if you're a guy, you're going to have a healthy, happy testosterone level.
Well, I think one of the best examples is Darryl's example of how he's uh, addressed the fact that his father had prostate cancer, and actually with his lifestyle, his PSAs are lower than the so-called normal. So he's a good example of how you can overcome uh, how epigenetics can overcome genetics.
So Popeye was right.
What did Popeye say?
Uh,
Fight to the finish when I eat my spinach.
Okay. All right. Okay. Any other comments about this article? But it's interesting how in the commercial they glibly point out that if you have a low testosterone level, that you should take testosterone glibly as though that's the panacea. Implicit in that is that if you take testosterone, your sex drive will be back to normal. That's implicit. They don't say that, but it's implicit in the commercial. Okay, let's go to the next article then. This is an interesting article that says low dose aspirin can it prevent cancer in older adults? And uh, here again, the data are interesting. It says it's good for some and not for others, which doesn't really answer the question as well. Although they have this trial that uh, makes you believe that low dose aspirin in older adults prevents some cancers, and the numbers are staggering. So that uh, but the benefit is not phenomenal. And that's why they had a question mark, because when all is said and done, whether the is it the aspirin effect or the other effects that decrease the incidence of cancer? No, it's we have on one hand that the uh, low dose aspirin uh, has its strengths. It also has its weaknesses. John Buchanan?
Yeah, isn't aspirin an acid? Acetylsalicylic acid?
Yeah, that's aspirin. What about it?
Wouldn't acid,
Acetylsalicylic, that's aspirin. Yeah.
negatively affect your digestive system?
Oh, well, that's why they have enteric coated aspirin, because that can affect your stomach, and uh, aspirin gastritis is well known, and that's why they have enteric-coated aspirin that protects the stomach from the acidity that is associated with aspirin.
Oh, thank you. Thanks a lot.
Any other comments about this study? As you know, there's a lot of discussion as to whether aspirin is safe for people who are over 65 who have no cardiovascular disease. People who have cardiovascular disease, there's an association of benefit, but if you don't have cardiovascular disease, the risk of bleeding and other complications remain a concern. And I guess the basic argument about the bleeding that occurs associated with aspirin being a cause for cardiovascular hemorrhage remains a concern, particularly for people who have no cardiovascular disease. And so you have a situation in which you have people who have cardiovascular disease who are given aspirin as treatment, and those people who have no cardiovascular disease who are not given aspirin because of its effects on the coagulation system. That's a dilemma that is one that remains to be answered definitively in the sense that some studies show that low dose aspirin decreases the incidence of cancer, but also increases bleeding. And so, which data do you believe? And there's so much data on the subject that it takes a Solomon to really decide what is the best answer. Okay, let's go to the next article that remains an enigma. Now, this is an article that clarifies the point that Medicaid expansion significantly improves long-term cancer survival. So you begin to wonder, well, if that's true because of Obamacare, why are we trying to eliminate Obamacare, which we are, as the Republicans are trying to do everything they can to eliminate Obamacare, but yet it has been responsible for improving long-term cancer survival and long-term survival of many other things. So if the evidence is clear, why are we spending so much time to prevent Medicaid expansion? Is a question. And it's a question that is part of the reason why we have this shutdown, because the Democrats are saying that the elimination of Medicaid is going to hurt millions of Americans, and the Republicans are saying it's going to decrease the cost of healthcare dramatically. So which is the more important of the two? And so that's what the shutdown is all about. Uh, who's going to win this war? Uh,
It's so sad.
Yes, it is.
Yeah, I think Republicans, well, one particular, the chief Republican, sees it as DEI. Get rid of it. And it will hurt a lot of people. But at some point, one of the sides will have to give in. And I think
well,
it
who's going to give in?
may have to be the Democrats. And once that happens, then yes, the Medicaid costs will go up.
Yeah, well, it's going to be interesting. So,
Yeah.
any other thoughts on who will give in first? I've never seen Trump give in on anything, so
That's right.
it'll be interesting
That's
to
right.
see how long this battle goes on. And the longer it goes, the more the Republicans will force their perspective on us. I think it would be unwise for us to believe that if they uh, if they win this battle, that the Medicaid expansion uh, uh, will continue because it's clear that it won't. Darryl?
Yeah, not only will the lack of Medicaid expansion reduce health care to people, it's also going to reduce funding that goes to hospitals, and it's going to cause hospitals to close, particularly in rural areas. In the South, typically, southern states, in the rural areas, typically your hospital is going to be an hour or two drive away, and if you have to get an ambulance ride to the hospital for an emergency condition, you may be dead before you get there. So it's an extreme crisis in the South.
Thank you for sharing. Any other thoughts? Well, we will be around to see what happens. It's frightening, scary.
Dr. Callender, I don't, it's hard for me to understand how this can even happen in our country. I mean, healthcare is a primary right. It's a responsibility of the government. Other governments have subsidized healthcare for their citizens, and I don't understand why. I guess I do. It's greed and everything in our government now, but it's just it's something that should never be taken away. It should never be challenged. So, I
So
mean,
you
for
think
people who
healthcare,
qualify, yeah,
you think healthcare is a right? Is that what you're?
I do, I do, I do.
Yeah, so do I. But for some reason, our country doesn't see it, and that's the tragedy of our country. Darryl?
Yeah, looking at it from a conservative point of view, they look at government funded medical care as being a welfare program or handout. And that's why they prefer a market driven healthcare system that's run by private insurers rather than a government handout. Even poor white people vote against their own self interest because anytime you say welfare, even though they don't realize they're getting welfare. If Medicaid is welfare, their automatic assumption is that welfare only goes to black and brown people. They vote against their own self-interest, but that's the difference. They call it a philosophical difference between the two parties. That Republicans prefer everything to be market-driven. Democrats are more socially concerned.
Thank you for sharing. Carol?
I think um, Trump, anything that Barack Obama did, he's going to go against it anyway. That's why he wants a Nobel Peace Prize, because Barack got it. So since this is Barack's health care, of course he wants it down. It doesn't matter if it destroys America or not. He just wants to be the one on top and destroy it. He can't even hang up Barack Obama's portrait in the White House. So that's a simple thing.
Yeah. So it's clear that that is one of his motivations. So. Okay, any other comments? John Buchanan?
Yeah, um I forget the name of the guy who did these videos about healthcare. He's pretty famous. He's done a lot of uh, programs that show uh, the health situation around the world. He said, like in France, and other countries, healthcare is covered by the government for everybody. So um, he had one guy who was really sick and couldn't afford care. Uh, went to Cuba, and Cuba has uh, national health care, and they fixed the guy, they covered him and paid for everything in Cuba, right down the street. It's very uh, maybe somebody knows the filmmaker I'm talking about. He's, he's done a lot of programs about different issues, but this is the one about international health care.
Okay, any other comments to share? If not, we can go to the next article. This is a lot of debate about whether you have egg or non-egg flu shots, and all of the studies have demonstrated that it doesn't make a difference whether you have an egg or non-egg flu shots. They both work, and uh, this is something that has been discussed over time, but basically, these studies show that there's no difference whether you have egg-based or non-egg-based. So, and I think all of us are getting our flu shots. By now, I hope all of us have gotten our flu shots, gotten the double dose if you're over 65. And whether it's egg-based or not, let's hope that it works better than 50% of the times. Has everybody gotten their flu shots now?
I'm late.
Okay, well, now's the time to get it.
Yep.
I'll get mines next month when I go for my wellness check at my doctor's office.
I've gotten mine.
Okay, now's the time to get it. Okay. All right, let's go to the next article then. This is an article with the flu myths that flu vaccines can be delivered to your house. I don't know anybody who's done it, but the flu mist is a nasal spray vaccine that was approved last year, and there's a hope that this will increase the number of people who get vaccinated. I'm not, I'm not one who believes that, but time will tell. I, One thing that was not clear though was the price of the home delivery, which I'm sure John Buchanan would ask about. But uh, John, I see your hand up.
Sorry about that. It was left up from the last time. Sorry.
Okay, Darryl.
Is the nasal vaccine as effective as a shot?
Well, there's evidence that it is effective. When you say as effective as a shot, I'm not sure. I believe that it is expected to be as effective as the shot. Yes, but as you know, the flu vaccine uh, is successful more than 50% of the times in increasing decreasing the likelihood of you going to the hospital or dying. And the same thing is thought to be true of the flu mist vaccine. Any other comments or thoughts about this new
In light of all the
availability of the
yeah, in light of all the controversy about vaccines these days, do you really think that the flu mist will be will encourage people to get vaccinated that may not have been otherwise?
I don't, but this article suggests that.
Yeah, I
I
know.
don't know. I don't. I doubt it. I doubt it will make a difference, but we'll see.
Maybe they'll get it for measles.
Uh,
I
okay, well,
think I think it'll make a difference because a lot of people are afraid of needles. So if they can just spray it up your nose, it's
Yeah.
easier.
I don't think it make a difference.
okay. Let's go to the next article then. This is an interesting new drug for idiopathic pulmonary fibrosis, which is a condition for which there hasn't been a new drug in a decade. Uh, it's a condition that is often genetically associated in families. Actually, my wife's family uh, had a lot of this idiopathic pulmonary fibrosis, and it's claimed a number of people in our family. And so, having a new drug that is effective for it is nice to behold. Uh, it's unfortunate that we still don't know who's going to get it and who won't, and which families have it and which families don't. And so it's going to be interesting to see how this new drug will be effective in decreasing the mortality and morbidity rate from idiopathic pulmonary fibrosis. Okay, I guess this is a condition that is not known by many, but it's a lethal condition. It's good to have a new drug that is available for treatment. Let's go to the next article, if there's no comment. This is a fascinating article that talks about a drug that is used for transplant, rituximab, which is a drug which reminds us of the uh, Nobel Prize winning in medicine for the medication that suppresses the immune system. And this drug, uh, with uh, multiple sclerosis, is now being shown that you can get the drug or dose once a year, and it will reduce the likelihood of recurrence of multiple sclerosis. Uh, it was given twice a year. Now it's shown that rituximab need only be given once a year to reduce the likelihood of flare-ups of multiple sclerosis. It's a remarkable finding, a drug that for a disease that was so lethal and problematic, and now have a situation where you only give it once a year. It's amazing what research can do. And so this is something that, of course, is cheaper once a year than twice a year. Any comments about it? Do you have anybody in your family, excuse me, with multiple sclerosis? I do. I have a couple of family members. And so it's remarkable to see how effective this new treatment is. People who were often paralyzed or unable to use extremities now can take this injection once or twice a year and have no more MS symptoms. So it's a major breakthrough. Any comments or anybody have multiple sclerosis in their families?
You know, it's what's interesting, Dr. Callender, is that this is not a new drug, but it's been used for a new condition, which is not new, but I mean a new opportunity. So it's interesting how some of our older drugs may be repurposed for other diseases than what we know them for.
Yeah, we used it in transplant for quite a while without
Yeah.
recognizing that it had this effect on multiple sclerosis. Yeah.
I had a question, Doc. You know my question already. How much is that shot?
Well, it's very cheap because now you only take one dose a year rather than a dose every other year. That's what made it so attractive is that it's a rituximab is not an expensive drug. So when it was twice a year, this means it's half the cost. So I don't know exactly what it is, but it's relatively inexpensive now. Major breakthrough for multiple sclerosis, though. Amazing. Okay, let's go to the next article. Now, we keep looking for side effects to the GLP-1 drugs. And the longer we have the drug, the sooner we'll find out all of the side effects of GLP-1 drugs. And this is now finding that it may slightly raise the depression risk. Uh, and I think that this will probably impact very little the ability to use this drug that is so effective in so many different conditions. But anyway, it's good, important to study and define this, the short and long term consequences of this miraculous drug that is revolutionizing the practice of medicine in the United States. And I'm sure that with time we'll find even more side effects and also learn how to treat the side effects better. It has so many wide-reaching uh, effects upon so many different organ systems. Although I think of Dr. Perez's comment how uh, doing studies in communities of color will be interesting to see what difference there is. And of course, the question is will the antidepressant that you give, will overcome the depression, and time will tell on that. So we shall see. This is a study done in Taiwan. Its impact on us in the United States remains to be seen. There's no comments. Let's go to the next article. This is the Nobel Prize was awarded last week to people from the United States and Osaka in Japan on the T regulatory cells that suppress the immune system and suppress rheumatoid arthritis and autoimmune disease like rheumatoid arthritis and type 1 diabetes. Because it's believed that these T reg cells will decrease the toxicity that results in from autoimmune disease that causes rheumatoid arthritis, which can be a lethal illness, and type 1 diabetes, which also can be a lethal illness. So the finding of these T regulatory cells that in the old days were called suppressor cells uh, is a brand new finding of a couple of decades ago that is helping in the battle of rejection and also in mediation of rheumatoid arthritis and type 1 diabetes. John Buchanan?
Yes, Dr. Callender. Were these two scientists working together or separately?
Separately.
Wow.
All three of them separately.
Wow.
I think there's a limit of three people who can be given the Nobel Prize. And I remember when they separately identified the Treg cells and then the FOXP5, and then eventually how all of those can be used in the management of rheumatoid arthritis and how it can be used in transplantation. So when you identify these regulatory T cells, that they will prevent rejection. And so its impact has not yet been demonstrated, because I think there's a lot more that will be manifest in the management of rheumatoid arthritis and in transplantation with these regulatory T cells. Just to let you know that the immune system, of course, is the backbone of what it's all about in transplantation. And it remains to be seen how this will help us eventually get to the point where we can reduce the amount of immunosuppression that's necessary to prevent rejection, short and long term, for transplant patients.
Dr. Callender, would this also work in stem cell transplant to prevent graft versus host disease?
Prevent what?
Graft versus host disease?
Yeah, it has potential. Hasn't been used for that yet, but it does
Okay.
have that potential, yes.
Okay.
That's an area that actually has not been studied, but it has the potential, yes, for that. In many ways, GVH is an autoimmune disease.
Mhm.
And so this then has the potential of doing that. That's the area that you first worked in, right?
Yep, long time ago.
Yeah, yeah. Hmm. Okay, well, that's an interesting article that a lot of people were thinking that Trump would win the Nobel Peace Prize, but that was not the case. Of
Then
course,
we'd really see some protests.
the revelation that some of this was started on by the Biden administration is also interesting as well. Yeah. I think the impact on lupus erythematosus will probably be an interesting one because we have more SLE than we seem
Mhm.
to be aware of. It particularly affects women, but and rheumatoid arthritis. I remember my classmate in high school who died from rheumatoid arthritis. And SLE, I have a number of friends who died from lupus erythematosus. So the impact of this drug on these autoimmune diseases can be immeasurable down the line. Well, let's go to the next article. And this is an interesting article because we've seen so many children who have died from food allergies. And when your children have food allergies, the psychological impact upon the parents is considerable. And much of it has not been addressed. We talk about the child, but we don't talk too much about the parents of the children. And this study shows that the parents are always afraid, and particularly the peanut allergies have killed so many people that the therapy for the family becomes something that is considerable as well. And this study shows that uh, the parents have benefited measurably by going to therapy for it. Any comments? Any of you have children who have food allergies, especially the peanut allergy? I remember Janice told us about her son who had a seafood allergy.
Seafood and
Now,
peanut.
what's that, Janice?
Seafood allergy and peanuts, but I told you this is after military. And he does have it. I didn't believe him until I gave him some by mistake, and big mistake. But he's handling it.
How did you and David handle it?
It didn't exist. I'm telling you. He went,
Until he went to the army.
every Friday we had fish. Everyone would come over for fish. And after he went in the military and came out, he said, "Oh yeah, I'm now allergic to fish and I can't eat peanuts." You're right. And one day we were at an event and he didn't want to eat their food, but yet he ate off my plate. And he said, "What's this crunch?" It's peanuts. "You know I can't eat
Uh-oh.
peanuts." And I mean, he started running around and jumping. He ran across the lot to get Benadryl, came back drinking it. And actually, it was a birthday party for my granddaughter. And my daughter in law said, "Take him somewhere. I got to get the kids out." We went to patient first. By the time he walked in the door, he was dripping, pouring sweat, swelling, itching. He's allergic. Carries an EpiPen,
He
but
almost died.
been for a couple of years now. But he's allergic to nuts and fish. I don't get it. He said it was from the shots he got when he went overseas. So,
Darryl?
I just did a search on why food allergies are increasing in children, and it says changes to dietary exposure that are being introduced to pathogens later in life. Things like they're not eating as many eggs and peanuts earlier, um, and just increased environmental cleanliness, which delays the immune system has fewer common pathogens to fight. and reduced time spent outdoors, meaning they're getting less vitamin D. So, I didn't have a lot of food allergies when I was growing up because I spent just about all my time outdoors. Um, got dirty, ate mud pies, ate everything, have a
But you
strong
said
immune system.
something. You said something, Darryl, I can relate. Not eating enough eggs. Chris never liked eggs. He never ate eggs. So did that have anything to do with it? I don't know.
Yeah. Well,
Yeah.
we have uh, one of our immunologists is going to be talking to us shortly. We're going to ask him those questions.
Mm.
Any
Uh,
other comments about food allergies and
my
parents?
my brother, rest his soul, had very serious seafood allergies. We had no idea. We were going across the country in '62, and he ate some crabs, and his face swelled up, his lips swelled up, his tongue swelled up, and he was ready to die because of the swelling. He couldn't swallow, he couldn't started not being able to breathe. We had to go to the hospital in Oregon. I forget the city. We were going to the World's Fair that year, and he had to get treated at a hospital. He could have died then.
Yeah.
Very serious how the body can react, the immune system can react to different stimuli.
Okay. Thank you for sharing. Okay, let's go to the next article. Thought this was an interesting article. This will be the last article, fortunately. Women in medicine belong at the top just as much as men, which is the truth of the matter. Uh, I think that they listed a number of challenges, 10 challenges. Tendency to conform to expectations and norms, perfectionism trap, reluctance to let go, the struggle to balance humility with self-promotion,
Huh?
uh, tendency to allow failure to lead to self-doubt, willingness to accept the false belief that soft skills are less promotable than the hard skills, and that showing vulnerability is a sign of weakness. Of course, it's really a sign of strength. And the struggle to shed the imposter syndrome and uh, focus on creating an executive presence and not making enough time to create a diverse professional network and investing in yourself. These are obstacles, actually. And they talk more about lifting each other up uh, and pointing out that women do a lot of the work but get little of the credit. And that probably is the number one issue, is that people take advantage of women in positions and will give them what they call secretarial duties, while not giving them the credit for the accomplishments that they make. And that's as true today as it was yesteryear. We still have a lot of women in surgery, but we have very few women who are in the top of surgery. But that number is increasing because it's becoming more and more evident that in medical school, 60% of the doctors in medical school are women. And so as the numbers increase, positions at the top need to increase, but they haven't increased appropriately. And so this is one of the big issues of the day. When we'll get to the point where uh, more women will be at the top, which is not the case right now. And this article just points out that we've had a tiered system in which whether men are superior or inferior, they're put at the top, and that is something that the women are about to change. So, that's what this article is all about, is that times they are changing. We've seen studies that have suggested that women make better doctors and more sensitive doctors, and there are also studies that suggest that they make better leaders as well. And so this is kind of a tip of the iceberg article that talks about how things were and how things need to change to what it should be in the future. Any comments or questions?
My last with Kaiser, I'll say my first three primary physicians were women, and I liked it. I like that. My present physician is a male. I don't like him as much. He's all right, but I like the women better.
Okay. Any other comments? If not, this is the last article. And next week, Dr. Coleman is going to talk about neurological problems of men and women over the age of 50. So hope you all can attend and take advantage of her expertise. She's presented to us on many occasions. We've been doing this for 50 years. She's presented to us at least 5 times. So we have this opportunity to hear from her. We also are expecting an immunologist to join us subsequently as well. Any closing comments?